Feels like going back in time, taking off a mask. Good afternoon, and thank you all for joining us here today for an important announcement. I'd like to recognize some colleagues from the House of Assembly and the ministers here to support today. People in Newfoundland and Labrador, like people everywhere, want to lead healthy lives, knowing, of course, that they have access to quality health care when they need it. It's a pillar of our universal healthcare system in Canada, and frankly, part of what it means to be Canadian. I've seen the problems within our system firsthand for years. Working alongside dedicated healthcare professionals, I've heard their frustrations and seen the toll long hours have taken on their faces and the limitation of resources. So I continue to focus on bettering our broken system. And I am proud of the plan our government has to improve healthcare for all Newfoundlanders and Labradorians. I created Health Accord NL to reimagine our healthcare system, to recommend ways to best deliver services to meet your demands in your communities, to match the modern Newfoundland and Labrador. Health Accord NL looked at how physicians and other healthcare professionals work together to meet the province's healthcare needs, both in hospitals and community settings. After all, we know things have changed. The workplace has changed. Healthcare professionals are not working in the old traditional ways. The time of hanging up a shingle in a small community and caring for people from cradle to grave, 24 hours a day, 7 days a week, is simply antiquated and a romantic notion. And government, as a government, we need to be there to support those professionals in that changing paradigm in a way that makes sense to provider and patient alike. Our government has a suite of initiatives and financial incentives to help improve healthcare based on engagement with stakeholders. And they include a heavy focus on recruiting and retaining healthcare professionals here in our province, like a new $25,000 retention bonus for family physicians, and an extra $200,000 that is helping us hire doctors in hard-to-fill areas and more remote areas, like Bonavista, which I'm proud to say is already working. Today, we have signed 2 new doctors in just 1 week for Bonavista. In all of this, we know team-based care is the best for patients and for providers alike. And we know working in teams is better for everybody. It's an essential feature of an effective and sustainable healthcare system, a modern system to meet the demands of a modern Newfoundland and Labrador. In keeping with the primary healthcare care transformation, Health Accord NL recommended we have been expanding family care teams, like the one here in Pippi Place, throughout Newfoundland and Labrador. A family care team consists of different healthcare professionals working collaboratively to best meet the needs of patients and their families. They generally include family physicians, nurse practitioners, nurses, pharmacists, social workers, and other allied health professionals. There are currently 8 of these teams in various stages of implementation throughout our province, with a goal of having to implement 35 in the next 3 years. Today, I'm excited to announce that with $21.2 million in Budget 2023, we will add another 10 family care teams this year, connecting up to 80,000 patients when fully implemented. This is a significant step forward for primary care across Newfoundland and Labrador, one our government is proud to make. Now, based on a needs assessment and availability of resources to support the team model, these will be established in a few areas immediately, or in the next year. Bonavista, Brookfield, Centerville, Clarenville, Conception Bay North, Gander, Grand Falls, Windsor, Humber Valley, White Bay, Labrador West, Port aux Basques, and St. John's. On top of the 10 new clinics, I'm very pleased to reveal the new logo and name for these family care teams. Until now, there have been multiple different names that we've all used. Collaborative team clinics, collaborative care clinics. But as you can see, that's a mouthful. But today we are officially launching them as family care teams. because they are all about providing quality primary health care for you and your family. These teams are a very important component of our plan to improve access to primary care health services for the people of Newfoundland and Labrador. It's part of our larger plan that is built on the Health Accord and recognizes global healthcare shortages following the pandemic and addresses short-term needs while creating long-term, sustainable change. Thank you very much for attending today, and I'll now invite Minister Osborne up for a few brief comments. Thank you.
Thank you, Premier, and thank you, everybody, for joining us today. Our government remains focused on the continuous improvement of our healthcare system in conjunction with our stakeholders that supports our health workforce and better health outcomes for residents of Newfoundland and Labrador. We have several areas that are first and foremost on our radar right now: recruitment and retention, better virtual care, improved emergency services, and the creation of family care teams like the one we are standing in today. We've already taken significant actions to address the current challenges associated with access to care, and today's announcement of 10 new teams for the province further advances our efforts. It was very encouraging that when we received the recommendations from the Health Accord, a number of the 59 recommendations included were already underway to improve healthcare services, including the implementation of family care team models to primary care. As the Premier indicated, we know firsthand that team-based care is best for patients. Students are being trained to work in interdisciplinary teams, and we know that working in teams provides greater satisfaction. We also recognize that the recruitment and retention of physicians and other healthcare professionals are ongoing issues, not only in Newfoundland and Labrador, not only in Canada, but around the world. The situation here in Newfoundland and Labrador is no different. We've implemented and continue to implement a number of measures to attract and retain healthcare professionals to work in our province, including those who will staff family care teams. Family physicians are an integral part of the province's healthcare system. It is important that as we continue our efforts to recruit physicians in our province, that we must retain those who continue to provide valuable care to the residents of Newfoundland and Labrador. Family physicians in Newfoundland and Labrador are now eligible for a $25,000 recognition and retention bonus for a one-year return in service. We've announced this week as well the rural retention bonus, and as the Premier announced earlier, the $200,000 incentive is showing progress. We will continue to work closely with regional health authorities on how to best address recruitment and retention issues, and we will continue to work collaboratively with stakeholders to provide adequate health services to the people of the province. While it is difficult to feel the immediate impact resulting from these initiatives, significant change takes time and solutions are complex, but it is all part of a larger plan. The 10 family care teams that we've introduced today are an integral part of that plan. I now invite Minister Cody to make some remarks.
Good afternoon, everyone. I want to first thank the Premier and the Minister for their knowledge, their strength, and their leadership. This has been an incredible amount of work that you've done, and I appreciate, and I think the people of the province appreciate all that you've done, and all that you are doing. And I also think I want to thank all the healthcare providers for all their emphasis and hard work in ensuring the best health for the people of the province of Newfoundland and Labrador. And of course, we appreciate the direction and guidance that we've received from the Health Accord and all the work and effort that has gone into laying out, I think, a good direction for health as we move forward. Your health is the priority of this government. The strategic priorities of access, of recruitment and retention, of transformation, all form part of that stronger health care that we're all working towards. Today's announcement is a significant one regarding availability. It means that Conception Bay North, Clarenville, Bonavista, Gander, Grand Falls, Windsor, Brookfield, Centerville area, Humber Valley, White Bay, Port aux Basques, Labrador West, and here in St. John's will have increased access to primary care. And that's something that we should all be very glad to hear announced today. The funding of more than $21 million in the upcoming budget for these 10 new family care teams is an example of how we are committed to the healthcare needs of Newfoundland and Labrador. And as the Premier said, there will be more emphasis on family care teams as we move forward. Next week, or later this week, just on March 23rd, we will have our budget. It's coming so quickly, days are cascading. But we'll have our new budget. And, you know, I think what you're hearing is your health is the priority of our government. Your physical, your mental, your fiscal, and your economic health. You'll hear more about this on Thursday when we present the new budget. I'm going to turn it over to Melissa Koch of Eastern Health to say a few words.
Thank you, Minister Cody. Good morning, or good afternoon. On behalf of Eastern Health, I want to thank you for allowing us to be a part of this important announcement today. As the Premier and Minister Osborne have said, team-based care provides high-quality care for the patients that we serve. The evidence is overwhelming that healthcare professionals have higher levels of job satisfaction as part of a team, and we are able to successfully recruit and retain them in a team-based environment. At Eastern Health, we have successfully built several teams in both urban and rural communities. Providing care to over 12,000 patients, our teams are reimagining how we provide wraparound care to the people that we serve. And I can say I'm incredibly proud of the work they do. Some of them are here today, and I thank them for their service. Some examples of this innovation include pharmacists working to full scope and utilizing virtual care to offer hypertension programming, improving chronic disease management for patients. Respiratory therapists working in the community, providing evidence-based programming for patients living with COPD and improving their quality of life. Physiotherapists and occupational therapists working with the broad community team to screen all patients over 65 years of age for risk of frailty and intervening early to allow seniors to age in place at home. Social workers helping patients navigate the system as envisioned in Health Accord NL. Registered nurses, licensed practical nurses, dietitians preventing and managing chronic disease, and completing comprehensive intakes, ensuring we can integrate the social determinants of health in the care we provide. Physicians and nurse practitioners working side by side, providing quality care and leaning on each other for their expertise, utilizing virtual care to improve access and patient and provider satisfaction. At Eastern Health and what will soon be the Provincial Health Authority, we are excited to be a part of the system transformation and rebalancing of the healthcare system to a community-based model of care. I will now pass it over to one of our physician champions, Dr. Keating Power, to share her experience.
Thank you so much, Melissa. On behalf of the family care teams, I would like to thank you for allowing our teams to be part of this announcement today. I have spent the majority of my career in the fee-for-service system. For 12 years, I worked in a great clinic with some amazing staff, colleagues, and patients. Quickly, however, the burden of running a business and a full-time family practice clinic took its toll on myself and my family. In 2019, I joined the COVID clinic, and it honestly changed my life. I was months away from closing my fee-for-service practice and leaving medicine altogether when the pandemic struck. The COVID response team opened my eyes to collaborative team healthcare, and it reignited my passion for medicine, and I have honestly never looked back. Today, I'm a proud member of the Eastern Family Care Team. Our team consists of a clinic manager, administrative staff, family doctors, nurses, and nurse practitioners, as well as other allied healthcare professionals. We work together to deliver a collaborative healthcare environment to patients. Our team is rooted in respect, compassion, and teamwork. Together, we engage and empower our patients and each other through a journey of wellness and meaningful purpose. We are focused on meeting people where they are in their healthcare journey and surrounding them with the support team they need. We are always challenging ourselves to understand why what matters now. And by doing this, our team is constantly evolving and exploring quality improvement changes. By being active learners and opening our doors to underserviced populations, we are decreasing the burden on the healthcare system, improving healthcare outcomes, and increasing access to quality healthcare. By working with our peer support programs such as the ANC, Doorways, and the Harm Reduction Team, we are providing patients with a place of emotional safety and the opportunity to achieve physical well-being. I believe building a system centered on primary healthcare provider voices, patient awareness, and equality will lead to patient wellness and ultimately to long-term healthcare sustainability in this province. Thank you.